What is asthma? Asthma, also called bronchial asthma, is a disease that affects your lungs. It's a chronic ongoing condition, meaning it doesn't go away and needs ongoing medical management. What is an asthma attack? When you breathe normally, muscles around your airways are relaxed, letting air move easily and quietly. During an asthma attack, three things can happen. Bronchospasm. The muscles around the airways constrict, tighten. When they tighten, it makes your airways narrow. Air cannot flow freely through constricted airways. Inflammation. The lining of your airways becomes swollen. Swollen airways don't let as much air in or out of your lungs. Mucus production. During the attack, your body creates more mucus. This thick mucus clogs airways. When your airways get tighter, you make a sound called wheezing when you breathe, a noise your airways make when you breathe out. You might also hear an asthma attack called an exacerbation or a flare-up. It's the term for when your asthma isn't controlled. Asthma has multiple causes. Allergic. Some people's allergies can cause an asthma attack. Allergens include things like molds, pollens, and pet dander. Non-allergic. Outside factors can cause asthma to flare up. Exercise, stress, illness, and weather may cause a flare. Who can get asthma? Anyone can develop asthma at any age. People with allergies or people exposed to tobacco smoke are more likely to develop asthma. This includes secondhand smoke exposure to someone else who is smoking and thirdhand smoke exposure to clothing or surfaces in places where some has smoked. Asthma is more common among females. It also affects Black people more frequently than other races. What are common asthma attack triggers? Air pollution, dust mites, exercise, mold, pests, pets, tobacco smoke, strong chemicals or smells, certain occupational exposures. You can be exposed to many things at your job, including cleaning products, dust from flour or wood, or other chemicals. These can all be triggers if you have asthma. What are the signs and symptoms of asthma? Chest tightness, pain or pressure, coughing especially at night, shortness of breath, wheezing with asthma. You may not have all of these symptoms with every flare. You can have different symptoms and signs at different times with chronic asthma. Also, symptoms can change between asthma attacks. What asthma treatment options are there? You have options to help manage your asthma. Your healthcare provider may prescribe medications to control symptoms. These include bronchodilators. These medicines relax the muscles around your airways. The relaxed muscles let the airways move air. They also let mucus move more easily through the airways. These medicines relieve your symptoms when they happen and are used for intermittent and chronic asthma. Anti-inflammatory medicines. These medicines reduce swelling and mucus production in your airways. They make it easier for air to enter and exit your lungs. Your healthcare provider may prescribe them to take every day to control or prevent your symptoms of chronic asthma. Biologic therapies for asthma. These are used for severe asthma when symptoms persist despite proper inhaler therapy. You can take asthma medicines in several different ways. You may breathe in the medicines using a metered dose inhaler, nebulizer, or another type of asthma inhaler. Your healthcare provider may prescribe oral medications that you swallow. How can I prevent an asthma attack? If your healthcare provider says you have asthma, you'll need to figure out what triggers an attack. Avoiding the triggers can help you avoid an attack. You can't prevent yourself from getting asthma though.